You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, oral surgeon, Dr. Cornell McCullom. Dr. McCullom, welcome to the program.
Thank you very much. It's a pleasure to be here.
So let's begin then with who's a candidate for dental implants and what are the different categories of patients that you see that come in for dental implants?
I'd categorize patients as single teeth implant patients, multiple missing teeth implant patients, patients who have been told they're going to lose one or multiple teeth, denture wearer patients who have been wearing dentures for just a few years,
okay,
and also denture wearing patients who have been wearing dentures for 30 or 40 years. They've been missing their teeth a long time.
Okay, now what are the age ranges of patients that are coming in? I mean, the youngest to the oldest that you've
that I've seen?
Yeah.
I would say the youngest probably around the age of 17 up to actually 90 years of age.
90 years old. And
Yes.
so they won't fall out. I mean, at 90 years old, I mean, the people that you've treated.
Correct. Will the patient actually fall out?
No, I mean, will the implant fall out?
No, it won't. Their healing is actually pretty much on the same level as anyone younger than them. So same as patients who are 30, 40, 50 years of age, their healing is just as well.
Sounds very painful. Is it painful? Is that something they complain about?
No, not at all. This is, in the realm of the surgeries that I perform, this is one of the more minor procedures as far as pain is concerned, and also the amount of technique that's involved. So, no, not at all.
Now, for people that don't know about your practice, you guys call yourselves the Dream Team.
Yes.
Why is that?
Well, because there's two specialists, my wife, who's a periodontist, Yetta McCullom, and myself, who is an oral and maxillofacial surgeon, and Dr. Robin Ferguson, who is a well-trained restorative dentist.
So she does veneers and all of those
She does
things?
veneers, correct.
Okay.
Exactly. The one thing we are missing is an orthodontist and a root canal specialist, but other than that, we consider ourselves performing high-quality work, so that's where the Dental Dream Team came in, and we're all under one roof. We're not in separate practices.
That is unique. Is that right?
Yes, it is. We actually started this Dental Dream Team about 10 years ago. I'd say 10 to 11 years ago. And it's funny that now over the years, we see other practices also transforming and bringing in. Yes, exactly.
And do you think well, number one, people don't like going to the dentist.
Correct.
Right? I mean, especially the oral surgeon.
Correct.
They're really afraid of you guys.
Correct. They come
Is
in
that
all the
right?
time. Correct. They come in all the time and say, you know, I don't like being here. I don't like you people, but I have to get this done.
Is
Correct.
that right? And now your wife says that they end up liking you guys.
Right. When they're finished with the procedure and they're walking out the door, they say, you know, I hope I don't have to see you again, but if I do, I'm coming back here.
Is that right?
So, yes.
Okay, good. Now your background and training, you know, great background. I guess you did your undergrad at Yale.
Yes.
You played on the football team at Yale.
Yes, we won
Tell me about that.
We won 3 Ivy League championships while I was there. So it was one of the better tenures of Yale football.
What was your position? What did you play?
I started out as a wide receiver, but at that time the offense didn't use wide receivers a lot, so I was transformed into a cornerback or a defensive back to utilize my speed. So.
Okay, so captain of the track team at Yale?
Team, yes.
All right. Now, when did you know you wanted to be a dentist and then an oral surgeon? And you have a medical degree, is that correct?
Yes,
as well?
correct.
Okay.
I thought about dentistry coming out of high school. My father kind of put the thought in my head that you want to be your own boss. He was a career military officer. He had gone to West Point.
Oh.
And so every year growing up, we moved someplace different. So when I was going into 10th grade, I was going into my 10th school. So the thought was, be your own man, make your own hours, move when you want to move, hire who you want to hire. And at that time in high school, I needed braces. So I was going to the orthodontist once a month, and he was paying that bill. So he thought that might be a good profession for me to consider, and I was open. You know, at that time, I wanted to be a professional football player, but dentistry was going to be my second option.
Okay. And you love it? Do you find that you really like it now?
Yes, I do. I don't think I would have liked orthodontics if I had stuck with it. I found out in dental school that I wasn't too good at bending wires.
Okay.
So the surgical medical aspect of surgery, of oral surgery, kind of drew me more than orthodontics, so that's what I gravitated to.
All right.
And I'm glad I did.
You don't seem like an oral surgeon, by the way. You don't act like one. And I don't know what one's supposed to act like, but
That's what a lot of restorative dentists say when they meet me. So I won't go down that road. So.
All right. All right. Okay, so back to the denture wearers. Okay, so we're talking about dental implants.
Yes.
Okay, so what are the options for denture wearers?
For denture wearers, there's a couple of options. One is to stay with their current denture,
Okay.
which a lot of patients don't want to do. They're looking for something different, something that will give them more retention. Their denture will fit more sturdy, something where they don't have to use adhesive. Patients, along with that gooey, creamy feel in their mouth, they're also swallowing and eating adhesive. The gagging that sometimes occurs with wearing an upper denture, uncomfortability of a denture, the embarrassment sometimes with the clicking or the clacking or the denture becoming loose. Did I mention swallowing adhesive?
Yeah, they just don't like that. So with the denture wear, you say with just 2 implants you could change everything. Tell me about that.
Yes, 2 implants. Let me show you this model, Randy.
All right.
On the model here, we have 4 implants. 2 in the front, 2 in the back. But as a minimum, a denture wearer would need 2 implants in the front.
Okay.
This would make a world of difference compared to their current
So just snap
denture.
in, snap out.
Correct. 2 dentures right here in the front. The denture snaps in, it snaps out.
They can eat?
They
chew?
can eat. They can eat much better than they are. It's not the most ideal solution, but it's definitely a step in the right direction.
Okay, okay.
4 implants would be even better. 2 implants in the front, 2 in the back. The
And
denture has
snap
more
in, snap
retention.
out.
It can snap in and snap out, or it can stay in permanently. The benefit of that is they can clean well around the implants. They can see what they're brushing and cleaning. Or the other option, which is kind of a higher end option, is a denture that goes in, it's screwed in place.
By you?
By me or Dr. Ferguson.
All right, all right.
It stays in permanently, and they're taught by the hygienist how to clean well around
So
it at
full
home.
arch of teeth with just 4 implants.
Or full arch of teeth with just 2 implants.
Okay.
Either or. So you have your options there.
So when I hear you say things like no more dentures,
Correct.
is that the future of dentistry, where dentures as we know them now will always be kind of fastened on the implants? Do you think that'll happen someday?
I smile because you say, is that the future? And I look at my history of practicing and I'm saying, yeah, actually, that was the past 5 years ago.
Okay.
So yeah, that's kind of the past, the current situation, and the future as we know it. You know, of course, I can't predict what's going to happen down the road or what's going to be invented, but right now, permanent dentures that stay in are what people want and desire. If for some reason it doesn't fit into their budget, then they go to the removable, but the denture is supported by 2 implants or 4 implants.
Okay.
And it makes a world of difference.
Now the upper. You brought
The
upper. You say people
Yes.
don't like the upper.
The upper.
Upper dentures. I mean, they don't like upper dentures.
Correct. I brought a model just to show this is a conventional upper denture. So this is what people have been wearing for decades to centuries.
All right, all right.
This model is an upper denture. You can see the palate here. This is the part that covers the roof of the mouth.
Yeah.
Patients don't like this because they can't taste their food as well. It covers part of their taste buds. The gagging, sometimes it reaches too far in the back of their throat and they feel like they're gagging when they're talking or when they're chewing. Sometimes they need adhesive to hold it in place because the bone has melted away over the years. While teeth are missing, while they've been wearing a denture, the pressure of that denture melts the bone away even faster.
Okay.
So adhesive is used to help support that denture in place. So patients they just get tired of this. You know, after 10 years, 20 years of this, and now they know something is better because of the internet.
So what can you do then with dental implants for the upper?
For the upper, same thing as the lower, except 2 implants is not the solution because of the quality of the bone of the upper.
Okay.
So 4 implants is a minimum for the upper.
And then they could eat whatever they want.
They can eat what they want, and the denture can still snap in or snap out, or it can stay in permanently.
Really? And so 89-year-olds, 90-year-olds are candidates
Correct.
for this?
Correct. I would say for the 4 implants in the upper jaw, in our practice, we've been doing this procedure for about 3 years now. The oldest patient that has gone through the 4 implants, all on 4, we call it,
Okay.
has been 84 years of age.
And that's a fixed set of teeth?
That's a fixed set of teeth, correct. They still come in twice a
Now,
year.
why would an 84-year-old want to do?
Why would they want to do this? Sometimes I ask the same question, but they want to do this because they want to eat better. They want to smile.
Okay.
They want to eat with their family, with their grandchildren, and not be embarrassed. I can tell you a quick story.
Sure.
We have a patient that came in, it was probably about 2 years ago, and she came in because her granddaughter saw her without her teeth, and she was afraid.
Interesting.
And the grandmother didn't like that. She came to our office. She heard our advertisement on the radio, and she wanted implants, and she wanted teeth that stayed in her mouth, that did not come in and out. So
you also worked on your wife, who works with you, her father, with dental implants.
Right.
Tell me about that.
My father-in-law. Yeah.
All right.
Well, my father-in-law was a dentist. He practiced for probably about 55 to 60 years. I worked on him when he was about 74, 75 years of age. He had a lower partial denture, and he wanted to get rid of it. So we placed a few dental implants around his lower jaw to give him fixed teeth. So he had teeth that stayed in his mouth permanently.
All right.
As the years went on, he developed Alzheimer's, and he developed a severe stage of Alzheimer's. One thing over all those years was that he still was able to eat, and he enjoyed eating. So despite what happened with the mind, he still had a nice smile, but he was still able to eat well until the last day.
Is this the happiest group of patients? I think you told me that on the telephone. Of all the dental patients, the denturers that come in, get some dental implants to secure.
Correct. I think there's two things that go along with that. One, they're the happiest group, and secondly, they appreciate it more than anybody else, which makes me feel well. So.
Is that right? I mean, did they say, I wish I'd have done this years ago?
Yes. But then they say, well, I didn't know it was available then.
Are there people, I guess there are, because you told me, that people that have been told, I don't have enough bone, you're too old for dental implants, that are actually candidates?
Correct, exactly. Trying to think, yeah, they feel like they're too old. Sometimes they feel like they've been functioning okay. They kind of adapted to the situation.
And pain is not something they complain about? I mean, that surprises me, by the way.
No, especially the older group. Older group meaning 60 to 85-year-old patients.
Because the bone, I guess, doesn't have much feeling at all.
Possibly, but also I think they've adapted to things over age, and no, they don't complain of pain, period.
So you don't even have to give them medications the next day in certain cases?
I prepare patients for the worst because I want them to be covered on all bases. So I do give them prescriptions. If they need it, they take it. If they don't, they don't. I would say typically they take the medication, and I recommend it.
Okay.
They take the medication the first day to play it safe. Why be Superman? Just take the medication so you're comfortable that first evening. The second day, play it by ear.
All right, okay, and backing up, because you brought another model. For people missing 3 and 4 teeth and have removable things in their mouth. Why dental implants?
This is a partial denture. You can see the metal lines the inside. There's clasps or hooks on the outside of the denture. Mm-hmm. These clasps hook onto supporting teeth, other supporting teeth, that eventually are worn down or loosened, and something needs to be done. They either need periodontal treatment by my wife, or they need to be removed, or they need a root canal. But it causes a domino effect or snowballing effect of losing other teeth. It's a quick fix. It's an inexpensive fix, but it's not the most ideal situation. And a patient still continues to lose bone, so somewhere down the road, they need something better.
They end up losing their teeth.
Correct.
So dental implants, no more dentures, get a fixed set of teeth, and it doesn't have to be painful.
Correct.
It doesn't matter if you're 80 or 90 years old.
Correct.
You still qualify. Now, does it cost more to go to an oral surgeon?
Than
because I guess a general dentist could do implants?
Do the same. No, it doesn't cost more. I think all our prices are all in the same ballpark. Of course, it varies from what part of the country you live in, but they're all in the same ballpark.
Now, people always ask us, wellnesshour.com is not a referral site. And I'm not trying to side with you here, but people ask, who should I go to? And I always say, go to a specialist.
Correct.
And so with all things being equal, and if it's about the same price, why not go to an oral surgeon that's doing this, right? I mean, is that how you feel?
Do you want my biased opinion on this?
Yes, I do.
Okay. Oral surgeons are trained for an extra 4 years after dental school in all types of surgery. So one thing, whenever anybody's having any procedure done, anywhere on their body, their mouth, their face, complications can arise. And you want someone who's well trained to be able to handle those complications, because you never know. So that's where my bias is towards oral surgeons.
All right, so do they need a referral to see you on dental implants?
No.
They go you to directly?
They come, yes, and especially with the internet and with websites and marketing on the radio and newspapers now, yeah, people do come to us directly.
All right, good. I want to thank you for coming on the show. Very interesting.
Thank you very much.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We'll be right back.